Thanks for tuning in to the Drive On podcast, where we're focused on giving hope and strength to the entire military community. Whether you're a veteran, active duty, guard, reserve, or a family member, this podcast will share inspirational stories and resources that are useful to you. I'm your host, Scott DeLucio, and now let's get on with the show. Hey everybody, welcome back to the Drive On podcast. Today, my guest is Dr. Erica Steele. Dr. Steele is the founder of Holistic Family Practice, where she specializes in natural health, healing, disease prevention, and holistic healthcare. And she's here today to discuss options for healthcare beyond the VA. I know a lot of our listeners who listen to this podcast use the VA for their healthcare, myself included. And while the VA is a great option for many veterans, there are some drawbacks, and it may not be the best option for everyone in every situation. So we're going to be discussing alternatives to healthcare that the VA may not be able to handle, just may not be equipped to handle. So welcome to the show, Dr. Steele. I'm really glad to have you on.
Yes, awesome. Thanks for having me.
Yeah, absolutely. So why don't you just tell us a little bit about yourself and your background for the listeners who may not be familiar with you?
Yeah, so my name again, Dr. Erica Steele. I'm a holistic doctor in family practice. I hold 6 degrees in my field. They're all in the natural healthcare space, ranging from psychology to laboratory diagnostics. I have hundreds of certifications, functional medicine, integrative medicine. So a lot of biochemistry, a lot of science, but then also a lot of, the wisdom of natural medicine and, all of the natural things that you wouldn't necessarily find in the traditional VA offices.
Right, exactly. And that's the thing that is really interesting to me because I know just through talking to other people who have been through the VA, myself included, it seems like the VA very often is very quick to just prescribe something to
Yeah.
control whatever the symptoms are of whatever it is that you might be dealing with. If you're having back pain, or if you're suffering from depression or anxiety or whatever
Yeah.
the issue is that you're dealing with, it seems like a quick prescription. Here you go, take this and you'll start to feel better, which in many cases is true. You will start to see less of those symptoms, but a lot of times these medicines have side effects and they're not always the most pleasant side effects. And so these types of things could be handled in a different way. And I'm not saying that every single case can be handled one way or another. Every case is going to be a little bit different, right? But in your practice, you treat veterans who are dealing with a lot of this type of stuff. Sometimes they are toxic from things that they're
Yeah.
exposed to in their service. So what are some of the things that you do in your practice to help people who are looking for these alternative ways of healing themselves?
Yeah. And so I think you've said a lot there. So I'll kind of break it down. So the first thing is oftentimes people, they find me out of desperation. I'm not their first choice, right? Because a lot of times they don't even know doctors like me exist. So that's one perspective. I did mention I'm also the child of 2 Marines. My dad was a drill instructor. My parents met in the Marine Corps. I live in Virginia Beach. Norfolk is right next door. My mother works for the VA now. So, they were in Camp Lejeune, the whole thing, right? And so I have a lot of direct experience. I treat veterans from all different, service branches, not just the Navy, but also the Marine Corps and Air Force and Coast Guard. And I've treated the gamut. And also treated many veterans that have been exposed to all kinds of things, right? And so, you know, in an allopathic model, right, meaning a standard medical model, which the VA is going to be privy to, right? Number one, let's look at the military mindset, right? It's like, let's go ahead and get this patched up so you can get back out in the field, right? Let's get this patched up so you can get back to work. So it's very reactionary, right? So you're already kind of thinking from that perspective already. And so it's all very reactionary to like, okay, we got to patch this up and get you back out, right? So now let's say you've retired out, it's the same mindset. It's like, let's get you patched out, but not necessarily to get you back out, but just get you out of my office. So a lot of times you have a lot of symptoms, not to mention the wait times, right? So
Mm.
people are getting sicker and sicker, right? as they're waiting and waiting and waiting to be able to be seen. So there's a lot of stress on the system. And unfortunately, in Virginia, you would think we have the greatest one, and our lag times are probably even worse, unfortunately, than let's say some that I've heard, from Florida or some of the other VAs around. I think some of the systems and modeling is kind of a part of it, but I digress. When we're looking to treat, right, in an allopathic model, they look to diagnose and manage a disease, right? So it's like, I'm going to look at your gamut of symptoms. I'm going to find the closest label. I'm going to label it as that. And then I'm going to look, and I'm oversimplifying it, but I'm going to look it up and go, okay, this medication or this procedure or this surgical intervention is designed for XYZ. However, a lot of veterans, as you mentioned, right? Let's just look at nutrients fueling the body, right? A lot of veterans, the food, that are given in boot camp, basic training, I'm shocked that people are living off of this. It's like very, very like, it's not nutrition. It's not necessarily the most, nutrient dense. And that's what's feeding the body. So that's the first thing we look at is nutrients and nutrition and really breaking a lot of those bad habits because that's going to give the body energy. Not to mention, if your body's not being energized properly, it's not able to naturally detoxify. Okay. Because that's just a part of the process. We fuel our bodies, it runs through the engine of our car, known as the metabolism, and then it leaves the exhaust pipe, the waste. But then let's say, so we're not fueling properly, it's slowing down in the engine, it's not eliminating out through the exhaust pipe. But now we put that human in an even toxic environment with mold and radiation exposure and nuclear reaction exposure. I mean, I've treated, veterans that or part of Fukushima and had to deal with all of that, right? And then, being over in Afghanistan or Iraq and all the burning and I had 20 something year old kids coming back who couldn't even walk up steps. Their lungs were just so toxic. And the mindset around the VA, nothing against the VA, again, it's great emergent care, but it's like, okay, let's patch this up and get you back out, right? Instead of let's figure out what you've been exposed to, right?
Right.
Or perhaps what we've injected into you, because that's the other thing. I have a Marine that she's no longer a Marine. She's retired out. And we did lots of tests, and the amount of vaccines that she's tested for toxicity from those, inoculations, which were necessary for service, that has now triggered an autoimmune reaction. And now she's dealing with RA like symptoms, right? The VA's way of handling it is here, go ahead, pain medication, steroid, which compounds the problem. And so it takes us time to be able to identify what it is, provide the nutrition that the body needs just to be able to release it on its own. And then we've got to really structure a detoxification protocol so that the body can actually heal itself by taking the pressure off of it. So I do a lot of detective work.
It sounds like it. And it also sounds like a lot of the individual cases are going to be different. That you're not going to get two people who served in the same location who's going to have exposure to radiation and burn pits and well, we all ate like crap in the military, let's just face it. Especially on deployment. I know we had a delivery on our fob when I was in Afghanistan and I was helping unload it, and it was pallets of food and stuff. And I just saw some of the stuff that was sitting on there. And before it even came off the pallet, it already had an expiration date on the label. And I was like, well, great. What have we been eating for the last however many months that we've been here? And, we're about to have this too. And it just kind of floored me that
Yeah.
that's what we are being sent,
Yeah.
not to mention the fact that we had a burn pit on the base and just down the street a couple miles and a place where we frequently would patrol and work in was this enormous x-ray scanning machine that emitted so much radiation that some of the people who were working there, some of the local Afghans who were working there, they were concerned that some of their friends, they kept getting cancer and they're like, what's going to happen to me
Right.
because I'm working here too. And come to find out, it was so much radiation. Like we drew like an imaginary line around this building. Like,
Mm.
don't go any closer than this because
Mm.
you're going to be a bad situation if you do. So,
Yeah.
I'm actually surprised I'm still still kicking, with
By the
all the
by the grace of God, for sure.
I know, right, for sure.
Yeah, yeah.
I'm clearly not done with whatever it is that I'm doing
Yeah,
here. So,
that
um,
resilience. Yeah.
yeah, but there's so many people who have so many different things, and you're absolutely right. You have to be a detective. And if the people who are treating these veterans are not doing the detective work, they're just, checking a couple boxes and saying, okay, yeah, this fits under this criteria. Let's treat it this way. It's not digging down to the root cause of the problem. It's really just treating the symptoms as opposed to the root of the issue. And our bodies are really incredible in terms of how well we can heal and recover from things if we allow them to. If we provide them with the right fuel and
Yeah.
the right energy and everything like that that we need. And so that's where someone like yourself comes in. And that's why I'm excited to have you on and talk about this
Yeah.
stuff, because there are so many medications, so many treatments and other things that go on that may not even be necessary
Yeah.
if we go down and figure out what the root cause of some of these things are. So, and this isn't, I'm not knocking the VA at all throughout
No.
this episode. I think the VA is great. I've dealt with a lot of great people from the VA, but it seems to me though that through some of these conversations that I've had with other veterans, um, that they just like to prescribe medications to treat these problems. And these medications can be pretty problematic, right?
Yes. Oh, 100%. Well, not to mention the, addiction component of it, right? Especially
Right.
if you're in pain, right? And, the VA definitely has a reputation of being very heavy-handed with, prescriptions. And again, it's that very like, let's get you, the mindset is like, let's patch you up and get you out, right?
Yeah.
And when you're hurting and you're not feeling well and you don't have the energy to advocate for yourself, you just kind of take whatever is given to you because you don't really know of another option. You don't really know that there's another opportunity, available to you. And sadly, I tend to get people at their worst when they've been to every doctor under the sun. They've been to all the specialists and they've exhausted so many options and they're in a very desperate state. And then they come in and, I have to take all this data on them. So I take 350 to 500 data points on each individual patient. And that's so to answer your kind of figurative question about like you're treating patients individually, absolutely. And the way we do that is we take all the data on them and then we create kind of a controlled experiment and then prioritize what needs to happen first because we can't address everything all at once. And that doesn't even, we're just really talking from a physical perspective. We're not even looking at the mental, emotional, psychosocial, spiritual, the environmental. I also treat a lot of Navy SEALs and their families and the, and special ops and the impact of trauma and how that has impacted them. And the more kind of training you had right mental training that they've had and more of like the suppression and lock it in the box kind of thing, the more I have to be very delicate when I'm approaching because I have to ensure that they feel safe and that their training's not activated where they're because they know how to hold on to stuff, but at a certain point it's really affecting them on a physical level because it's literally eating them from the inside out. So again, like this is way more than can be done in, a 15-minute appointment and or an appointment that you have to wait 6, 9, 8, 10 months. I mean, I see patients every 3 weeks. Patients have access to me. If they have a question, they can shoot an email. And just having that high touch really helps reassure the person to go, okay, he's there for me. Somebody's got my back.
Right.
Me, myself, I laughingly say I was recruited at birth, having Marines as parents. I was recruited at birth and I went AWOL at 16 when I left my house, and so having post traumatic stress myself, just being a product of 2 Marines when the Marine Corps did not care that you had children, they weren't issued to you. So, just deal with it. And so, yeah, it was, people don't talk about the impact of that, but I digress, like just the whole consciousness. And then, of course, the adapt and overcome, once a Marine, always, I mean, I'm totally indoctrinated with all of those concepts. And so having to heal myself and personally understanding the impacts of trauma and how you're working with people with trauma, it's not just a physical thing, right? Yes, there's nutrition issues. We know that. Yes, there are toxicity issues. We know that. But then there's also just the humanity issues and the things that have been seen. And how does the mind and the body and the spirit process all of that? And how do they come home to themselves and get peace with themselves, let alone their families? And so that's why, of course, suicide rates are through the roof. That's why, of course, divorce rates are so high because, really, and I'm not saying that those resources aren't available, but it's a matter of trust and wait times and the ability to have access, I think, is the most important.
Yeah, for sure. I know uh, you touched on something with the suicides and how high those rates are. Ultimately, the reason why this podcast even exists is because personally, I've known several people that I served with, that I deployed with, who came back home and took their lives. And I was like, this is just not okay. And I realized just how prevalent of a problem it was throughout the military and the veteran community. And I didn't want to just sit around waiting for another phone call saying another friend is gone now. And I'm sure no one else wants to do that either. And so I felt like I needed to do something, right? And maybe this isn't the best thing that I could possibly be doing, but it's the thing that I found that can reach a lot of people, and providing resources like what you're providing through your practice is, in my opinion, it's a big benefit to the military community because, uh, like we said in the beginning, a lot of times all the veterans think of are, as far as the options that they have available, are through the VA.
Sure.
And that's not necessarily true. There's so many providers out there that offer all sorts of different things that are outside the VA box, if you will. There's alternative forms of, mental health and
Yeah.
physical health and other, just so many different things that are out there. And so I try to highlight as many of those as I can on this podcast, stuff like what you do. And I know you said that you're in the Virginia area. Do you work with people outside of that area? Or are you
Yes.
mostly in? Yeah, okay.
No, I work. So, a few things about me. So, I work internationally. I can work with anybody all over the world. We do it through telehealth and remote. The other thing that's very different is, so I only accept insurance for labs, right? I don't accept it for my service fees, which means I am a private provider, which means that unless my records are subpoenaed or unless the person releases signs for them to release, it's completely private. And so that also, for security purposes and for, all sorts of reasons with the military, right? Making sure that their autonomy is protected and their
Yeah.
privacy is protected and that they're able to express and communicate in a safe space, knowing that this isn't going to end up somewhere on a chart and that sort of thing. I've also helped a lot of people through their disability and, helping to prove those kinds of cases as well, because unfortunately or even just giving them advice into how to approach those things because of the nature of what's happened to their systems, mental,
Right.
emotional, or physical. And so I really, coming from a military family, I'm a huge military family. Even my uncles, like every single one of them are in the military, and so my grandfather too, coming from a huge military family, it's really important to be able to, just like you, it's like I saw so much, as a result, even though I was very proud of I am very proud of being from a military family. I have also been impacted by so many of the nuances to it. So it's like, you know what? I want to be out of the box. I want to think outside of the box because that's really how we're going to help people, not from this linear, medication, surgery, kind of this conveyor belt of healthcare that people seem to get on. And that's even outside of the military too, but it's definitely very prevalent in the military. Again, because it's more of you're, a product, you're a number, you're an asset number, right?
Mhm.
And so there's really not much care going on in the healthcare system, especially in the VA, unfortunately. I think they
Yeah.
mean well, but delivery, yeah.
Yeah, and there are so many people who work for the VA that are doing the absolute best that they can with the resources that they have available. It's just, it's a huge system, and it people fall through the cracks, unfortunately. And things are, they sometimes they might feel like they have their hands tied and they can't treat everybody exactly the way they might want to because maybe this is not an approved course of action or whatever. So that's the thing that bugs me with the VA. I wish it was one of those things where, uh, everybody just had the option to go wherever they wanted and
Yeah.
get whatever the treatment it is that they needed through people like yourself, and everything that was
Yes.
just covered, right?
Yes.
But I think that peace of mind, first off, you were saying earlier, you like to build that trust with the patients that you're seeing, but knowing that whatever is said, whatever is discovered, whatever comes up through your sessions and the everything else, it's private. It's going to stay between you and the patient,
Right.
and that's as far as it goes. And that to me would be a huge relief if I was still in the military,
Right.
thinking, how is this going to affect my security clearance, or
Yep.
how is this going to affect my job? Will I be able to continue working my job, or, whatever? I, that would be a huge relief knowing that I can get the care that I need
Yeah.
without jeopardizing any of those other things
Right.
professionally. And that would give me that sense of security, knowing that I can trust this person. I can provide the information that is truthful and will actually help get
Exactly.
me on the right track. So that way I'm not just prolonging this unnecessarily just because I'm afraid to
Yeah.
commit to certain things that I
100%.
may have done
And
or whatever, right?
yeah, and not to mention the fact that I take it very slow, right?
Mhm.
I'm not gonna be, and also too, I don't have like a motivation, right? My motivation, and again, being private, I work for the patient. So I'm not necessarily working for a conglomerate with another, kind of conflict of interest. I'm working for the individual, right? And so I can take it as slow as I need to with the person, depending on what they've been through, or I can take it as efficient, right? And I'm always trying to help that person see the hope, see the potential, see the possibility that they have to be able to transform and heal, right? And I use my own experiences, as a product of, two wonderful, loving Marines, as examples because I've seen it and I've been through quite a bit, right? And that also it builds reassurance and builds trust because it's like, oh, it's not just me. Because a lot of times people that have been through trauma, been through experiences feel siloed. It's like, oh, this is only happening to me. This is only happening to me. Everybody else seems fine. Why am I the one that's so messed up? There's all these crazy thoughts that are happening. And when you have somebody that goes, no, I totally get you. I understand you. I'm validating and recreating that. It's like, that's again such a huge relief. And I will say this to the VA's credit, they are actually beginning to look at other things outside of the box. They are beginning to look at acupuncture. They are beginning to look at obviously hyperbaric chambers popular. They are beginning to look at chiropractic, mind body practices and things like that. They are beginning. So there's a window there, right? It's still within that structure and that system. So it's like 1,000 people bum rushing to appointments, right? So there's still that. But I think even the VA opening up, right, it is amazing. And even too, with now they're doing a lot more plant medicine, different practices. Of course, not within the United States, but they are sponsoring them in other countries as well where plant medicines are legal. There are some in different states. I think Utah has some plant medicines that are legal. Colorado, I know, and obviously California and Oregon. So those are also other ways where, we do the pre-integration, they do the treatment, then they do post-integration. But again, you have to be prepped for that. You have to be ready for that. There's a whole, like, line that goes into that, right? A whole runway, if you will. And so there are more resources available. I think it just really depends on the person's open-mindedness, willingness. And it's like, look, where you're at right now could be your rock bottom. You could go down from there, or you could choose to kind of take that breath and take that leap and get to the other side. And sometimes when you have something to hope for, like either a relationship or your children or just something outside of yourself, even though we want intrinsic motivation, but sometimes we need to use things that are accessible to go, okay, I need to
Yeah.
pull myself together and get myself out of this hole that I'm in.
Well,
So
that's a great point and a good example of finding something bigger than yourself
mhm.
to push you to keep going or to get better than where you're at. When you're at that rock bottom moment, it's hard to see that there's other things out there. But
Mm.
when you start thinking about your spouse or your kids or the people who rely on for something. Maybe you're, in your community, you're, maybe a EMT or a firefighter, or, someone like that. It's like there are people who rely on these people
Yeah.
to go and save them. And so if you are going to give up on yourself, you're also giving up on those other people.
Yes.
And when you start to realize that, then it's like, okay, now I have a purpose again. I have a mission. I have something to fight for. And I'm not going to fail this mission. I'm going to keep going. I'm going to keep fighting. Just like when people were in the military, they have this mission, whatever the mission is, but usually there's somebody else that they're willing to sacrifice for. Maybe it's the guy on their left or their right as they're going into a combat or something. They're willing to sacrifice themselves for that. But
Yeah.
if they're not at their peak performance, they may not have that opportunity to
Yeah.
be able to help that other person. And so that's why you see these military guys and gals who are in the gym, they're getting jacked, they're taking care of themselves because they know that they may need to help somebody else out in the future and they don't want to let that person down.
Yeah.
And that's, I think, just as important after getting out of the military. There are people who are counting on you.
Mhm.
Could be your family, could be neighbors or coworkers or whoever. They're relying on you. And
Yeah.
so do all that you can to make yourself peak in all areas of your life,
Yeah.
your physical, your mental, your spiritual, your all areas of your health and your life. I mean, just focus on that and get
Yeah.
to be as good as you can so you can be there to help those people,
And
right?
it's definitely totally, it's definitely a mind shift too, because it's like, I'm doing this for the person on the left, person on the right. I'm doing this for my country. I'm doing this for this mission, right? And then now it's like, oh, but I'm supposed to be doing this for myself,
Yeah,
right? So it is this little like, oh, well, doing it for myself is selfish and all this kind of stuff, which I think doesn't serve people in a lot of ways, right?
yeah,
However, you use what you got. If it's the neighbor, if it's the friend, if it's the spouse, if it's the kids, if it's the whoever, the job, it doesn't matter until you have that momentum to go, I'm doing this for me now. Right.
right.
And so then you can utilize that. And then what's amazing about going through this process is if I hadn't had a crazy life, and believe you me, it's still in a lot of ways I'm like, really, so if I wouldn't have had the experiences that I had, I wouldn't be the person I am. I wouldn't be able to relate to so many people. I wouldn't be able to help so many people. So even though it may seem totally grim, there's a reason for everything. And I know it's like I roll like whenever people say that, like God would give you something hard, whatever. We all know the cliches, but really at the end of the day, it is true, right? And also to bringing this into a spiritual conversation, creator God, whatever you want to believe, right? He does know your heart and he does know what you're capable of. You may not know what you're capable of, right? And half the time I'm like, really? Like I don't have any more left in me. But obviously someone does. Otherwise, we wouldn't kind of keep going through these cycles. But I also know that if we continue to keep moving and we continue to put one foot in front of the other, and we continue to just be open to the process, we will find and get the resources that we need in order to feel better, in order to
Right.
transform. It's just a matter of having the willingness and the desire and being open to receiving it. And I think once people begin to kind of get that momentum, then they're unstoppable for sure.
How would someone know that the type of treatments that you offer and the stuff that you do in your practice, how would someone know whether or not that's right for them? Is there some sort of kind of guidelines or things
Yeah.
that you focus a better on than other things? How could someone kind of decide for themselves whether or not to
So
even
I
reach out?
would say that I get people that again have been to every doctor under the sun and no answers. They feel like they're getting sicker and sicker with no result. The treatment that they're getting doesn't make sense. And they don't have to have a medical degree to recognize that it doesn't make sense, right? They're frustrated with their healthcare providers. They don't feel like their healthcare providers are listening to them. They hate doctors. I hear that all the time. I hate doctors. I don't like doctors, but you're okay. So it's those kinds. I think intuitively, people know when what they're doing is not working.
Yep.
And so they need to find, what definition of insanity, doing the same thing and expecting different result, right? Some of us like the insanity, right? And other people, they're observant of the insanity and they want to get out of it. And then some people are observant of the sanity, they want to get out of it. And now it's like, oh, perfect. I listened to this podcast and now, this is the next step, right? I really am very much a believer in inspired action. And when you're supposed to hear the message, you hear the message. And if it resonates, it resonates. And you don't have to question that. Even if you're like, I don't know, like even if there's something there, right?
Mm.
It may not be today, it may not be tomorrow. I have patients that have followed my work for years and then they finally build up the courage to come into my office and they're like, okay, now that I've torched down everything else in my life, I'm ready.
Right.
I wasn't ready 2 years ago. You pissed me off the first time I met you. I mean, I've had so many people get upset, because I trigger people because I tell people the truth. And so, sometimes people aren't ready to hear that, and that's fine. I don't take it personally. But I think if there's any inkling there, then it's like, okay, I'm curious, right?
Right.
I'm curious. Maybe I'll watch some of her videos. Maybe I'll watch her on TV. Maybe I'll kind of, do the sniff test. I get that a lot with special ops. They're always doing the sniff test with me, because it's like, because they're trained, right? And so, I try to take it really easy. I am authentic in who I am. What you see is what you get. There's no other ulterior motive other than, trying to facilitate and help heal millions of people on this planet while I'm here. So that's my mission. So,
Yeah, absolutely. So you mentioned that you work with people all over the place, so it doesn't necessarily have to be local to your community, although I'm sure that there's plenty of that going on too. But where can people go to get in touch with you, find out more about your work and the types of stuff that you do?
yeah, so I'm all over every social you could imagine, IG, Facebook, all the things. You can Google my name, Dr. Erica Steele. I'm on television often, so you can look at I talk a lot about trauma. I talk a lot about that sort of thing. My website, holisticfamilypracticeva.com. I've done free webinars on various different topics from detoxification to nutrition to mental health. I mean, you name it. I'm a holistic doctor through and through. So the reason I have 6 degrees is because I wanted to understand the complex human experience. Because when you come from complex humans, like I did, you want to you're like, I know this isn't normal. I don't know what normal and healthy is,
Right.
but clearly this is not it. And so I kind of went on a pilgrimage to kind of understand, and I love my parents and they're great and they've grown up so much since, their days. I mean, they were like 20 years old in the Marine Corps, like, oh my, mind blown. I look back at them and I go, oh my God, they gave you 2 guns. What, so, but at the end of the day, there's just so many opportunities to reach out to me through all the different channels. I'm very accessible and I do that for a reason because sometimes all it takes is just that one going, you know what, I'm just going to reach out and see what happens. And so I try to be as open as I can.
Yeah, that's great. And I will have links to all of this in the show notes for anyone who is listening who wants to reach out and find out more about this practice and how it can maybe benefit you and the situation that you're finding yourselves in. You can go ahead, check out the show notes, click through the links, and you'll be able to find all the socials and the websites and everything that you can use to find Dr. Steele and everything that she has going on. So with that, Dr. Steele, it's really been a pleasure chatting with you and hearing about the type of practice that you do and the work that you've done with veterans and other people who have, all sorts of, different issues. But ultimately, it looks like, just drilling down to
Mhm.
the basics and finding out, well, okay, what's the root cause of these problems and how do we treat these in, maybe a more natural, holistic kind of way that will use the body's strengths to work towards achieving this goal. And to me, it just is a breath of fresh air when we hear about all these overdoses and addictions and all this other stuff that's going on in the news and around the world. This is just another way of looking at things. And I think it's a good way of looking at it. So I appreciate all of the work that you do. And thank you for taking the time to come on the show.
Awesome. Thank you so much for having me.
Thanks for listening to the Drive On Podcast. If you want to check out more episodes or learn more about the show, you can visit our website, driveonpodcast.com. We're also on Instagram, Facebook, Twitter, LinkedIn, and YouTube at Drive On Podcast.